Colon cancer is the new silent epidemic. Are you curious about the messages your gut health is sending you? Were you aware that colon cancer ranks among the deadliest cancers due to its often silent onset? Globally, colon cancer stands as the third most diagnosed cancer, predominantly affecting those over the age of 50. However, a concerning trend is its increasing occurrence in younger populations. Don't be left in the dark. In this segment, we're unraveling the 7 essential warning signs of colon cancer, a subject vital for all, regardless of age. We're not just sharing facts, we're imparting potentially life-saving knowledge. Remember, being informed is your greatest strength. By the end of this video, you'll possess the awareness to spot these warning signs early, potentially extending your life by years. Plus, you'll be better equipped to talk to your doctor. The importance of early detection in combating colon cancer cannot be overstated. Your health and well-being are our top priorities. Without further delay, let's dive in. Sign number 1. Blood in your stool. Ignoring this could be a grave mistake. True, not every cause for concern is dire. Consider hemorrhoids, for instance. But such symptoms are also frequently associated with colon cancer, leading to missed diagnoses. Should your healthcare provider downplay your symptoms and the bleeding persists, it's imperative to listen to your instincts and consider seeking a second opinion. Imagine noticing blood post-bathroom visit. It's akin to your body sounding an alarm, signaling that something is amiss. This bleeding could stem from inflammation or damage within the colon, and in cases of colon cancer, early detection is paramount. Were you aware that the 5-year survival rate for colon cancer, identified at an early stage, can exceed 90%? This underscores the importance of treating this symptom with the seriousness it deserves. Repeated instances of blood in your stool should serve as an unmistakable warning. Thus, if your restroom experiences resemble a scene from a thriller, it's time for a professional evaluation. Sign number 2, change in bowel habit. To be upfront, discussing colon cancer inevitably brings us to the topic of bowel movements. A hallmark of a healthy colon is the regularity of bathroom visits for bowel movements, ideally daily. The ideal stool is the epitome of ease, soft, brown, and effortless to pass. However, it's time to take note if there's a shift in your routine, such as increased frequency or an unexpected struggle during bowel movements. This could be your body's way of signaling a problem. Such changes are particularly significant for individuals over 60, but let's not overlook the younger demographic. They're not exempt from risk, but there's more to it than just how often you go. The shape and consistency of your stool matter too. Are your stools unusually hard or alarmingly thin? Do they tend to float rather than sink? These details might seem minor but can be indicative of underlying issues. A sudden alteration in your bowel habits could suggest colon cancer, as it may disrupt the normal functioning of your colon. Sign number 3. Discussing diarrhea is crucial, as it transcends mere inconvenience. By diarrhea, we're referring to experiencing 3 or more loose, watery bowel movements within a single day. While the culprit could be that last spicy meal, ongoing episodes warrant a deeper look into your body's health signals. Persistent diarrhea could indicate colon cancer interfering with your colon's ability to function correctly. Normally, your colon absorbs water from digested food, but cancer can prevent this from happening efficiently, resulting in liquid stools. However, there's more to be vigilant about beyond just the consistency. Be aware of accompanying symptoms such as abdominal cramps, a pressing need for bathroom visits, or a feeling that you haven't completely evacuated your bowels. It's not solely about how often you go, but also the characteristics of the stool itself. Is there an unusual odor or a change in color? These nuances are important. Diarrhea can lead to dehydration and the loss of essential nutrients, so it's not something to dismiss lightly. Our aim isn't to alarm you, but to arm you with the knowledge necessary for maintaining your health. If frequent visits to the bathroom are becoming a regular part of your routine, it may be time to discuss this with your healthcare provider. It's always better to err on the side of caution. Number 4. Sudden and unintentional weight loss, a critical health alert. Experiencing a noticeable decrease in weight without any changes to your diet or physical activity levels can be a sign that should not be ignored. This unexplained weight loss, particularly when it is rapid and unintended, can be an important warning sign of various health conditions, including colon cancer. It's crucial to understand that while weight fluctuations are normal, significant weight loss without trying signals that your body might be under stress or fighting an illness. Why it matters. Weight loss that occurs without effort might initially seem like a welcome change, but when it's significant and unexplained, it raises red flags. The body may be unable to absorb nutrients properly, or it might be expending extra energy to combat an illness, both of which can lead to weight loss. In the context of colon cancer, the disease can affect how nutrients are absorbed in the colon or lead to a decrease in appetite. If you notice that you're losing weight without any changes to your lifestyle or diet, it's imperative to consult with a healthcare provider. They may recommend a colonoscopy, a diagnostic test that allows a doctor to examine the inner lining of your colon and rectum. A colonoscopy can help detect colon cancer and other conditions that might be causing your symptoms. This procedure is especially important if you're experiencing other symptoms associated with colon cancer, such as changes in bowel habits, abdominal pain, or the presence of blood in your stool. Beyond colonoscopy. While a colonoscopy is a vital tool in diagnosing issues within the colon, your doctor might also suggest additional tests to get a comprehensive understanding of your health. These could include blood tests to check for anemia, which can result from bleeding in the colon, or other markers that might indicate the presence of cancer. Cancer early significantly increases the chances of successful treatment. When caught at an early stage, treatments can be more effective, and the survival rate is much higher. This is why paying attention to warning signs, like unexplained weight loss and seeking medical advice promptly is so crucial. While sudden and unintentional weight loss might be alarming, it's a symptom that should prompt you to seek medical advice rather than cause panic. With the right diagnostic tools and early intervention, the underlying cause can be identified and treated accordingly. Remember, your health is paramount, and taking proactive steps to address changes in your body is key to maintaining it. If you're experiencing unexplained weight loss along with other concerning symptoms, don't hesitate to reach out to your healthcare provider. It's always better to be safe and informed about your health status. Rectal bleeding stands out as its own concern. Think of it as an unexpected and unwelcome visitor that appears just as you conclude your time in the restroom. This type of bleeding is often more noticeable and can understandably cause quite a bit of alarm. While rectal bleeding could indicate colon cancer, it's crucial to remember that it often stems from less ominous causes, such as hemorrhoids or anal fissures, small tears in the tissue around your anus. The key takeaway is not to dismiss this symptom. Seeing blood after a bathroom visit should prompt a cautious approach, urging you to consult with a healthcare professional. It's an essential step, as early detection plays a pivotal role in effectively managing conditions like colon cancer. The sooner any issue is identified, the better the prospects for addressing it successfully. Ever experience that frustrating sensation where your belly feels like it's on the verge of bursting post-meal, or an odd, persistent ache that refuses to fade? Often, we might write it off as a reaction to something we've eaten, or just an off day for our digestive system. However, it's crucial to pay attention when these symptoms persist without a clear cause. Ongoing bloating or abdominal pain might be subtle indicators of something more serious, like colon cancer. We're not addressing the occasional digestive upset here, but rather a continuous, unsettling sense that not everything is as it should be. This is particularly concerning if accompanied by changes in bowel habits or the presence of blood in your stool, signaling potential red flags from your body. Let's take a moment to consider the importance of our gut. It acts as a command center, offering insights into our internal health. When it sends out distress signals through symptoms like unexplained bloating or pain, it's not merely griping. It's communicating critical information. Ignoring these signs isn't an option. Proactively seeking medical advice can be pivotal. The early identification and management of conditions such as colon cancer can significantly alter outcomes, emphasizing the power of early intervention. It's a hefty dose of information, but grasping these signs could very well save lives. Remember, age is just a number when it comes to your health. Whether you are 30 or 65, paying attention to your gut health and staying vigilant about any unusual symptoms is key. Don't be afraid to seek a second medical opinion if you feel your doctor is dismissing your concerns. Lifestyle choices play a significant role in the risk of developing colon cancer. Factors like consuming a lot of processed meats, obesity, smoking, and heavy alcohol use can all contribute. If you have a family history of colon cancer or notice any of the symptoms we've discussed, don't delay in consulting with your doctor. Catching it early is crucial. We're so grateful you're part of our community. If this video struck a chord with you, or if you have a story to share, we'd love to hear it in the comments below. Your stories not only inspire but help lift everyone on their journey to better health. We're eager to produce content that resonates with you, so please, let us know what topics you're interested in. Catch you in our next video.